Hi, and welcome to Covering Your Health with Evelyn Erives. I'm so excited for you to be here today. IEHP, my partners, we have been working very hard to bring you some great episodes with very compelling content. And today I think you're going to really enjoy this one, especially because, well, it really affects just about all of us. We're talking about your eyes, your vision, why it's so important to visit your eye doctor. Did you know it's estimated that 4 in 10 adults are at risk for vision loss? That's real. That's a straight fact. That's a little scary, isn't it? Today, we're about to find out and welcome Dr. Brandon Friedman to the podcast. Dr. Friedman is an Inland Empire based optometrist who will share some tidbits about why we should always incorporate an eye exam in our annual checkup to do list. I can't wait to dive into this eye-opening topic.
Welcome to Covering Your Health, a wellness podcast dedicated to covering all areas of living a healthy and happy lifestyle. From healthy hearts to understanding health plans and everything in between, each episode will provide you with a better understanding of managing your health, preventative care, and staying on the right path for your family's wellness journey. The Covering Your Health podcast is presented by IEHP. Now, your host, Evelyn Erives.
So welcome, Dr. Brandon Friedman. How are you?
I'm doing great. How are you?
I'm really good. I'm so excited to have you here. Let's start at the very beginning. I want to know a little bit about yourself. I want to know your origin story. Why eye health? Tell me it all.
Well, I am a native of Southern California, born in Redlands, grew up in the mountains in Lake Arrowhead.
Oh, beautiful.
And as many times as I threatened to leave California, I just could never do it. It's too wonderful of a state. I went to college in Santa Barbara, optometry school up in Berkeley, and came back to my roots here in the Inland Empire to practice optometry. I love what I do. I'm very grateful for my profession. My educational path started by studying psychology. I really loved studying the human mind, human behavior. I did a lot of research in my college years, but came to a moment where I realized I really wasn't wired to be a therapist, and research was not something I wanted to spend my life doing. So I took a step back, looked at a lot of different areas of healthcare, and really just took a great interest to helping patients with their vision and with the health of their eyes. And the rest is history.
Wow. Were you ever fascinated, like as a child, with eyes? Or what do you think was the trigger for you that when you started to study that a little bit more?
I would not say that I had a passion as a child. My father's an optometrist, so I was
Oh,
around the profession and the industry, throughout my entire life. It was my summer jobs working the office, but never really took an interest to it as a career path until I was in my early 20s. And I think really what drew me to it is the fact that optometrists, we really do get to spend more face-to-face time with our patients than almost
mhm.
any other healthcare professional. And patients, I think in general, are excited to see their optometrist because of the ways that we help them. And that brought me a lot of joy when I looked at different professions and thought, boy, I want my patients to actually like me, and I want them to actually want to come into the office and see me
Yeah.
and not fear coming into the office. And I think that's something that really in optometry we embrace and we thrive with.
I was going to say, I always think that way too. I'm never afraid to go to my optometrist. That's nothing I'm worried about. I'm not going to have a cavity, you know?
Yes.
I mean, there are things that can happen, but you're never truly worried about going to the optometrist. Um, but you know what's funny about that is because I'm not worried about it, sometimes I forget about it. Like, it's one of those things like, oh, I got to get to the eye doctor. I need to remember to go. So before we get into all of those little intricacies, and I'm sure there's a lot of reasons why people maybe avoid the optometrist, tell me why you decided to practice here in the Inland Empire.
Well, I think if you look at our communities, we have a lot of underserved communities in the Inland Empire. These are communities that don't have as good of access to healthcare as other parts of our state.
Mm-hmm.
And that is in a large part is what drew me here, to be able to support underserved communities that really we could make a difference in the quality of their lives and in their families' lives by bringing great state-of-the-art eye care to those communities. And that more than anything else really drew me here. My family's from here, so of course
Hmm.
I love being near my family and my parents. But when it comes to practicing optometry, the opportunity to serve people in this area that really need our help is a big draw.
Yeah, yeah, that's wonderful. I kind of I can feel I can understand that because with me, I grew up here in the Inland Empire and getting to do radio here in the Inland Empire is so special, because I grew up with all these people. I get to see them every day and I feel like practicing the same way with you is the same way people are like, "Oh, I knew Brandon growing up. I'm going to go see him too." You already have like a built-in base, in
Yeah,
some cases.
I've got it pretty good, I'll admit. And when I was, pretty green in the profession 15 years ago, and just trying to get the flow of things, that really helped me get up and running. Is kind of the instant trust, the name recognition, and just the fact that I knew the communities and I could
Yeah.
connect with people about where they're from in a way that maybe other doctors couldn't.
Yeah, yeah, absolutely. I love making small talk with my optometrist too because it's always fun stuff. What have you been up to? Oh, I remember. On to the next thing. Nothing too crazy. Okay, so let's talk about the eyes. What are some common misconceptions people have about the eyes?
I think the one that I hear the most when I am working with patients is the concern that wearing glasses can weaken or hurt their eyes. And I have a lot of folks who come in and say, well, I know that I see better with my glasses, but I try not to wear them as much as I can. I really don't want to get used to wearing them or get dependent on wearing them. And there's really not a lot of truth behind the concern that you will hurt or weaken your eyes by wearing glasses. Glasses correct vision, they sharpen vision. In many cases, they reduce the work the eye has to do to see clearly. And there are tremendous benefits to that. Much the way you might not want to walk around with a backpack filled with bricks. And taking the bricks out of your backpack, you're going to be more comfortable and be able to walk a little bit further. So when we provide glasses to our patients, we want them to see clearly with very little to no effort, so they can go about their day, whether it's going to school, sitting on a computer screen all day, driving a
Mhm.
bus. There's really no benefit to withholding better vision by avoiding glasses.
Yeah, yeah. I mean, I feel like this goes without saying, but why should people stay on top of that eye health?
Well, and that's an important aspect, is that eye health really, if you look at an eye exam, I think a misconception about eye exams is, hey, I'm coming in just because I can't see and I need my glasses, I need my contact lenses. That's what I'm
Yeah.
here for. That really is a big draw for why patients come in to see their optometrist.
Hmm.
But a huge part of the exam is focused on the health of the eye and making sure that we find early risks for eye diseases. One of the biggest concerns about eye disease is that the vast majority of eye diseases don't have symptoms early on. So
Mm.
it's not reliable to ask a person, hey, when you have a problem with the health of your eye, please come in. At that point, we might be too late. So having annual checkups with your eye doctor is really a fantastic way to get on top of that, to detect early risk for eye disease well before it starts to affect the vision.
Like well before you even notice any kind of issue, right? So let's
Exactly.
say let's say I put things aside. I haven't been in there in a little while. And now I'm starting to notice some things. What are some signs that maybe there are issues with your eyes?
Well, it's really tricky because if we rely on the symptoms that a person experiences, we're going to catch a lot of conditions too late. So when
Okay.
it comes to, for example, a condition like glaucoma, which is the third leading cause of blindness in adults in our country, glaucoma starts to affect the vision on the far edges, the far sides of our vision, and you won't notice that.
Mm-mm.
We really can't appreciate that loss of vision. So we wouldn't want to wait till we notice, hey, I have a blind spot on the side of my vision. Maybe I have glaucoma. That would be an unfortunate time to catch glaucoma. Uh, other conditions like dry eye, for example, which is very, very common in the Inland Empire,
Mm-hmm.
redness of the eyes, burning of the eyes, excess tearing or watering of the eyes. These are common symptoms of an eye that may be dry, and we manage a lot of dry eye in the practice because of the air quality and
Yeah, I was gonna say.
the dry air that we have, and the wind,
Mm-hmm.
of course.
Mm-hmm. Always the wind. Oh my goodness. I feel like people in Fontana and Devore get it the worst.
I sure do. I
Yeah.
have massive respect for those folks in the wind corridor.
I grew up in Fontana, so I remember wind days. And we're like, oh, don't go outside. Okay, so how can someone prevent vision loss from does that begin at a very young age?
Absolutely. When we talk about children, and there's oftentimes an assumption that kids are healthy, and that's generally true. But one big thing that we want to be mindful of for our youthful individuals is protection from the sun and reducing ultraviolet exposure to the eye
Hmm.
by wearing sunglasses, by wearing a hat with a brim. We know that about 50% of our lifetime exposure to ultraviolet occurs before we turn 18.
Wow.
And so
Oh my
kids are
gosh.
getting a lot of UV. Granted, it's good for kids to go outside and play. There's so many benefits to being outdoors and playing and being active. But we need to protect our eyes because many, many eye diseases that occur later in life are accelerated by exposure to ultraviolet. So you may not
Wow.
feel it when you're young, but it adds up throughout our life.
So, I mean, is that a good reason to wear, I don't know, sunglasses when you're young?
Absolutely. We should be getting
Okay.
sunglasses on our kids before they can talk. And that way they're so used
Wow.
to wearing shades that it's just part of their routine when they go outside. And granted, I had sunglasses on my children when they were 1 day old, and it's still a struggle even now when they're 9 and 7 years old. But getting in that habit and that routine is a really healthy habit for children.
That is something I never knew. Okay, that for sure I never knew that. So, because for me, I would say in my later teens, it was cool to wear sunglasses. You know what I mean? It was like I wanted to wear sunglasses. But then I grew to just like only want to wear sunglasses sometimes. You know what I mean? I go outside and I'm like, oh, it's way too bright out here. I'm constantly wearing sunglasses. So I wondered, oh my gosh, do I have a sensitivity, to the sun that I'm always like it bothers me, right? But I would never have thought that I've got young kids too. They should all be wearing sunglasses.
Absolutely.
Oh,
Absolutely. And also, the sunglasses protect the skin right around the eye, and that very thin, very delicate skin is
oh yeah.
vulnerable to things that we always think about, like wrinkles and sagging
Yeah.
eyelids, but
Aging.
also to skin cancer. It is a
Oh,
very
wow.
vulnerable part of the skin for cancer. And sometimes when we apply sunscreen to our face, we may not coat that skin because we don't want to get sunscreen in our eye. So sunglasses help assure that we protect the skin around the eye as well.
Oh my goodness. Okay. All right. So very important sunglasses. Going to buy my whole family a family pack of sunglasses.
All right.
Make sure I'm on that bandwagon. Um, what about the importance of wearing just like other types of glasses? Is it okay to start your kids young if like with readers and things like that? Because I remember wearing them when I was maybe three, no, like third grade, third or fourth grade, and then not needing them again. Is that normal?
It can be. It depends on what we're correcting when we talk about a pair of glasses for a
Mhm.
child. Ultimately, with children, we know that the eye and the brain are rapidly developing their connections during the first 10 years of life. So if there's something going on with the eyes and the vision that might delay the development of the eye, we need to catch that as early as possible. And if
Mhm.
glasses can help improve that development, we will put glasses on a baby and keep them in those glasses as long as we need to ensure that the development of the eye proceeds on schedule. And of course, to make sure that they can see clearly so that their education is not impacted by their vision as well. But some children, maybe they are a little bit more farsighted than the average child, which means they have to work harder to see clearly. That extra work is not harmful to the eye itself, but it could lead to headaches or blurry vision. Maybe a child who can't read for very long and they get tired, glasses would be very helpful. And some kids can outgrow that farsightedness. It can decrease. So it really depends on the
Oh,
type of correction in the glasses. But at the end of the day, if we're using glasses in a child to help the development of the eye and the brain, that is something that they're going to need to be in glasses all day, every day, until
Hmm.
we really feel that we're out of the woods or something changes for the better in the eyes.
I see. Okay, so let's talk about some of the other maybe diseases that you don't necessarily think affect the eyes. Like let's talk about diabetes.
Mm.
So, what is the impact that diabetes plays on the eyes?
Well, diabetes as a whole, I mean, it's a really scary condition in general.
Mm,
38% of Americans have diabetes. 25% of those people, almost 10 million people, don't even know they have diabetes.
that's scary.
It is the
So
leading cause
scary.
of blindness in adults in our
Wow.
country. And a lot of people don't realize that. They think about diabetes, they think about um, controlling their weight, controlling their sugar, and that's very, very important. But uh, losing vision from diabetes is absolutely devastating. And so we spend a significant amount of our days as optometrists in general, not just me, but my colleagues as well, really examining the eye for early signs of damage and educating our patients. And again, back to the theme of, hey, we talk to our patients more than most doctors may. Sometimes it's the optometrist that has that breakthrough moment with our patients, and getting them to realize the importance of really taking responsibility for their health and taking the lead on getting the diabetes under control, not only to protect their vision, but also their health in general.
Wow. Yeah. And it is something you don't think about when you hear like you're pre-diabetic or you hear the words that you have diabetes. I don't think anyone thinks directly about their eyes in that moment. So, and you can you see that? I mean, as let's say you're having a regular appointment with your optometrist, can you see signs of diabetes before maybe the person even knows?
It does happen. In fact, just last week, I saw a patient that's been my patient for many years. And we were doing a routine exam. We took a few photographs of the retina, which is the inner back wall of the eye. There's a lot
Hmm.
of blood vessels that you can see in the back of the eye. And he had spots of bleeding in both eyes. And this was the first time in many years of exams that we'd seen this. And so we started talking about diabetes and other cardiovascular conditions like high blood pressure and high cholesterol. And it had turned out that this individual hadn't had a physical exam with his primary care physician in many years. So first thing we
Oh,
did was got him scheduled for a physical with blood work. Uh, Fortunately, since a lot of people do get regular care with their primary care doctors, I don't find diabetes in the eye before they know about it very often.
right, right.
But it does happen, and especially in an underserved community, you're going to see that happening even more often.
Wow. That's amazing. Yeah. I mean, here's the thing. We went through a pandemic, right? People put off going to the doctor again. And I feel like that's one of those things that we're still kind of getting back on track. I will say I'm getting back on track with like all the things that we missed, right? Getting back on to our dentist appointments and things like that as well. So it is possible. Like I feel people miss those annual visits, especially if maybe your insurance doesn't incentivize those things. Sometimes they say, hey, you have to have one if you want to have your lower rate, right? You don't, you just might not go. Nah, nothing's wrong. I feel fine. Well,
Absolutely.
make your appointments. So how can you help ease stress associated with vision checkups?
Well, I think in general, many folks are nervous to go to a doctor's office. Just
Hmm.
that fear of I'm going to find out something that's wrong with me, and I'm scared of that. And that's a natural human emotional response
Yeah.
to adversity. And I think really when it comes to easing stress and anxiety, um, I really approach it through um, trying to display kindness and clear communication. If you talk to your patient and you educate them about what we're doing, what we see in the eye, what we can do about that, I think that really takes a lot of the fear out of those visits. Uh, if a patient has had an experience where maybe they went to see a doctor and the doctor walked in, had their back to them during the whole exam, writing in their chart, and then writes a prescription for a medication, hands it to them, and walks out the door, they don't receive the kind of comfort and guidance that they maybe really deserve and need in those moments.
Yeah.
And so I think we as optometrists have an opportunity to provide education. And when you understand what's wrong and why it's happening, and especially what you can do about it, a lot of that fear starts to drain away, and the anxiety, doesn't take control of your emotions, and you can
Yeah.
actually step up and take action for yourself.
Okay, but how about the dreaded thing that gets blown into your eyeball?
Yes, the oh
That's
so
the
wonderful
fear.
eye pressure test. Well, I can tell you that in our practice, we retired the air puff about 3 years ago
Really?
for a technology that is more reliable and more accurate. But the fear is there. And even 3 years later in my practice, I still have patients who've been our patients for years coming in. All right, when am I getting that air puff? Let's get it over with. And it is unfortunately a deep, profound fear that has infiltrated society. But the reason that we test the pressure of the eye is that if the pressure is high, then that's a risk for glaucoma, which we
Okay.
talked about earlier as a condition that can cause blindness without even realizing it.
Yeah.
So it's important that we check the pressure. But fortunately, with some of the newer technologies coming out, we may start to see less and less offices using the air puff.
Nice. Okay. I'm all team get rid of the air puff.
I'm with you. I'm with
It's
you.
it's so funny. That's the only thing I think when like, oh, that's the one thing I dread.
I was so proud to tell my patients when we retired this thing, hey, don't worry, no air puffs today. And yeah,
Nice.
I don't know if they fully believed me when I said it, because it's just such a core experience of an eye exam.
I know. I know. I feel, and my kids too, they're like, oh, the one thing. Everything else we don't care. He'll take the one thing. Okay, so what is the earliest you can get an eye exam? I mean, how, like, months old? Are you talking like first grade? Where are we at?
Young months. So
Months.
the American Optometric Association recommends the first eye exam between 6 months and a year of age.
Okay.
These exams are really intended to detect concerns that could impact a child's vision and their eye health and their development. And of course, you're not going to give a 1-year-old the same type of exam that you're going to give an 8-year-old.
Right.
They are not going to be able to respond or really cooperate with exams. But we are trained to be able to take measurements of the eye without requiring responses from our patients. We do often need to use eye drops to dilate the eyes in a young child because it helps get more accurate readings. But we can learn a lot about the eye at a young age and learn if there are developmental risks that we can intervene on. And there are a few very scary health conditions that are extremely rare but very serious in babies, and we want to catch those if they are present in the eye.
And at what point do you start seeing your optometrist? Is it's an annual visit, right? Or do some people go in twice a year or 3 times a year?
Yes, absolutely. It depends on your health and what concerns there are for the eye. For an average person who has healthy eyes, who doesn't have any underlying health conditions like diabetes, we would generally plan a visit every 1 to 2 years.
Mm-hmm.
And these are your routine checkups. I like to think of those checkups like the annual physical for your eye. We are
Mm.
not coming in there because there's a problem. We are coming in there to cover the health from front to back to make sure the vision is corrected and accurate. But we're not panicking. We're getting ahead of things with those visits. However, if you have a condition like glaucoma, macular degeneration, maybe there are some complications from diabetes that we detect in the eye, then we may plan visits more frequently so that we can watch more closely and make sure that we catch changes as early as possible.
Okay. For someone who now I wear glasses at work when I'm looking at a screen all day. Um, my kids look at screens, especially in the summertime, more than I would like them to.
Mhm.
What is your take on the blue light glasses? Is are they really needed?
There's some benefits. I think that between some of the marketing that's gone on in the last few years, and some of the fear that came out of the remote learning and remote work wave that
Mm-hmm.
happened during the early parts of the COVID shutdown. Uh, there was a lot of fear about all the added screen time that we were encountering.
Yeah.
And obviously, a lot of folks stayed in remote work environments, and some kids even remained in remote learning environments. So we need to be aware of some of the risks with screen time. Blue light itself is nothing new. The sun transmits 40 times more blue light than any screen that you might look at. So it's
Okay.
not as if we magically are encountering blue light like we never did before, but it can increase fatigue and eye strain. And so wearing glasses that reduce blue light can help reduce some of those symptoms that may occur for longer hours. But what's really great is a lot of the software and computer companies, Microsoft, Apple, Android, they have all integrated blue light filters into their software. And
Oh,
so you can go into the settings on your displays and actually reduce the amount of blue light that's coming out of the screen. And a study a few years back found that that was a very, very effective way to reduce blue light. And so in general, I don't know that for a person who doesn't need glasses, that I would wear glasses exclusively to block blue light.
mm-hmm.
But if you're already wearing glasses, then adding a coating that reduces blue light is not a bad idea. And if you do a lot of computer time, maybe it can get you through those hours a little bit more comfortably. But I always recommend get the blue light filter settings adjusted on your computer screen so that you're not having to filter as much out because you're not looking at as much in the first place.
That's a great idea. I never even thought of looking at settings to see if that was even a thing. I would never know.
Absolutely.
Okay, one more thing before I wrap up with you. I want to ask you, for someone who's never worn glasses, they're healthy. They've never had problems. They're in their late 20s now and they're starting to see like, okay, maybe I need to wear glasses. I'm getting a little bit of headaches and I'm going to go to my doctor. And let's say you say, okay, we're going to put you in a set of glasses that you're going to wear. What is the process? I know the process, but walk us through what somebody getting a new pair of glasses or contacts, I guess, uh, is for that patient who may be scared about it.
Sure, absolutely. Unknowns are always scary.
Mm-hmm.
Well, it all starts with the eye exam. And so when we come into an annual exam, frequently referred to as a comprehensive eye exam, it begins by getting a good understanding of someone's history of their health. What background do they have? Are there any health concerns we should be aware of? Any eye concerns that we should be aware of? Of course, we're talking about the invincible 25-year-old here,
Oh
right?
yeah, right. We don't need nothing.
Yeah, you can't do anything to knock down a healthy 25-year-old, right?
Right.
Until they're not 25 anymore. But once we get through an understanding about their health, we want to learn about their demands. What do you use your eyes for? Are you staring at a computer 8 hours a day and then switching to your phone for the last 4 hours? Are you spending your time outdoors? Maybe you have a job that involves outdoor time. Are you a student? As we learn about the way that we use our eyes and the demands on our eyes, it can really help the optometrist understand how we can help that person with their vision.
Mm-hmm.
And through the discussions, we sometimes learn of some areas that maybe they didn't realize they were having trouble with. A
Oh
good
yeah.
example is, hey, when you drive at night, can you see individual headlights or do you see a big starburst in your vision? Oh
Yeah.
yeah, I just thought that's how it was. Well, maybe we can help with that. So we want to really work through and learn where there are areas of struggle. The exam itself, we do some measurements of the vision. We try to get the eye focused as clearly as possible, and of course check the health of the front and the back of the eye thoroughly. And then if we determine that glasses are needed, the next step would be to meet with an optician. Opticians are trained individuals to assist in selecting a frame for glasses that fits the face well and is comfortable. Of course, style and fashion is always a factor with this part of the process, and making sure that any options on the lenses are chosen. And blue light filter would be one example. Transition lenses that darken or lighten depending on whether you go outdoors. And that way, these glasses function the way that would benefit that patient the most. And
Mm-hmm.
so, in general, we would like a patient to be guided and hands-on through the entire process from the moment they walk in to the moment they leave. And that way, even if you've never been through it before, it isn't scary. It's a smooth and comfortable process all the way through.
Yeah, and it really isn't. It really isn't scary. It's not too bad. Okay, so we're gonna wrap up here. I want from this whole conversation, I know I'm gonna go make my appointment with my eye doctor now because I'm due.
Excellent.
What are the three key takeaways that anyone who is listening today should come away with? What should people know a little bit more about the eye or about visiting?
I would say that right off the bat, healthy living and healthy lifestyles lead to healthier eyes and better vision. And getting out and taking that morning walk and doing your daily exercise routine and maybe skipping that second cheeseburger and picking a glass of water instead of a glass of soda. These are things that we can do to improve our health. And the eye is part of the body, and the things that can harm our body can harm our eyes. So living healthy life is really important. Your community eye care provider can play a really important role in helping not only to correct your vision, but also to detect early risks for eye diseases through annual eye exams.
Mm-hmm.
And especially for folks who have diabetes. I think that's really a very big takeaway there. And really at the end of the day, understanding that you shouldn't wait for there to be a problem before you try to fix a problem with your health. And whether you're talking about your eyes or your heart or any other part of the body, we want to take the approach of preventative healthcare. You know, you don't wait to do an oil change on your car when your engine's smoking. You want to make
Yeah.
regular oil changes to protect your car. So we want to treat our bodies in the same fashion. And so making sure we keep up on regular eye care is a very, very important way to keep your eyes healthy and to see well.
I love that. Those are three. They're very clear. Healthy living. Don't skip your exams. And of course, don't wait if something is going on with your body or your health. Thank you so much, Doctor. This was wonderful. I appreciate your time today. I do. And how can people learn a little bit more about you or if they want to go and see you in your practice?
Oh, well, I appreciate the plug.
Hmm.
We have two locations in Ranch Cucamonga, which actually we're in the process of building a bigger and nicer location in Rancho. So we'll be relocating hopefully in the early fall. And we have an office in San Bernardino as well. Probably the best way to find us is through our website, which is friedmanoptometry.com. But I will say that there are many fantastic optometrists throughout the Inland Empire. And I know that the folks who live in our communities can find a good optometrist nearby their home, even if it's not Friedman Optometry.
Nice. Thank you. Oh, so it's a pleasure to have you here. Hopefully we can have you back if there's another topic you could think of. I know there's always something going on.
There's
But
always
yes,
something, Evelyn, and I'd love to come back, but thank you so much for having me.
wonderful. Have a great day.
All right, take care now.